Hello everyone, welcome back to my channel. So this side, Dr. Alpana. I am a certified dentist and I have done my post-graduation in public health. So today we are going to discuss about a very important topic which deals with dentistry, that is diabetes and oral health. So you might be a little shocked to know how and why we are talking about diabetes and oral health, how these both are related, and why we are talking about the both issues in same topic. So hello everyone, welcome back to my channel. So this side, Dr. Alpana. I am a certified dentist and I have done my post-graduation in public health. So today we are going to discuss about a very important topic which deals with dentistry, that is diabetes and oral health. So you might be a little shocked to know how and why we are talking about diabetes and oral health, how these both are related, and why we are talking about the both issues in same topic. So as you know, diabetes is really very common worldwide. So we can classify diabetes into type 1 and type 2, and the type 2 diabetes could be due to lifestyle changes and many other causes. So we are going to talk about the relationship of diabetes with dental health and the diseases which deal with tooth and gum health. So let's start the video and stay tuned. So when you visit your dentist, even if you don't know your medical condition, whether you have diabetes or any other manifestation of diseases, you come up with some symptoms. So people who have uncontrolled diabetes, they have severe inflammation of their gums, and whenever a dentist see a patient, they are easily able to classify them and able to segregate them from normal patients. So how a person can be classified and could easily be detected for the disease? A dentist can easily send the patient for some laboratory test, which could later be confirmed, and treatment is changed according to their condition. So a person who has uncontrolled diabetes, has inflammation in gums, have a burning sensation in their mouth, whenever they are brushing their teeth, that blood oozes out, and they might have some fungal infections. So these are some of the symptoms which a person could have whenever he visit a dentist in cases of uncontrolled diabetes. So the question arises, how diabetes and gum health are related. So people who have uncontrolled diabetes are more prone to have dental health problems, as people with having great fluctuation in their blood glucose level could have severe changes in their white blood cell count, because it alters the defense mechanism of our body. And when the defense mechanism of our body gets altered, it is going to affect every tissue in the body, as so does the gum health. So the tissues surrounding the teeth are also affected by the altered immune system, which is later going to affect the overall health of teeth. Talking about the supporting structure of teeth, gum health is of prime concern. The basic focus should be on improving the gum health. In conditions where teeth are not getting properly cleaned and are surrounded by plaque and tartar, they are more likely to get infected, and in longer term it could affect the tissue supporting the teeth and the supporting structures, and it could alter the gum health, which could lead to a deeper penetration into the gingival tissues and the periodontium, and which could easily affect the gum health. So gum health is of prime concern. If your gums are not intact, they will not be able to hold your teeth, and your teeth is more likely to get loose with time. So people who have uncontrolled diabetes come with plaque and tartar deposits in their teeth. And whenever we don't focus on our teeth and we don't brush it properly from using the best techniques of brushing, we are really more likely to get severe infections of periodontium and the gingival structure supporting our teeth. So we should take care of our gum. So if you have uncontrolled diabetes and till now you have no dental manifestations of diabetes on your teeth, so what you can do is you can get your sugar test done regularly, and you should brush your teeth at least twice a day. Brushing could also be useful if you do it after taking your meals. You should use a mouthwash. Preferably a chlorhexidine mouthwash is really going to help you. You can use a chlorhexidine mouthwash thrice a day. And you also use floss and interdental brushes if you have severe crowding in your teeth. So people having uncontrolled diabetes, and also for everyone, the first one I'm summarizing you can do is brush your teeth at least twice a day. Second one would be you can use a mouthwash, basically a chlorhexidine mouthwash. Mouthwash could be used thrice a day, and you can use interdental brushes, which would reduce the build-up between your teeth. And you can also use an interdental brush if you have severe crowding between your teeth. So let's talk about further. So people who have uncontrolled diabetes and who have started getting symptoms or the oral manifestations of the disease, what they could do. They could first of all get their blood sugar levels tested in regular intervals, and they could take their medicines in time. And secondly, they should have a regular brushing routine schedule, as I talked in the video, for people who doesn't have got the manifestations till now. They can do 2 time brushing in a day, and they can also use chlorhexidine mouthwashes along with brushing. And the chlorhexidine mouthwash can also be used thrice a day easily, and interdental brushes and floss can also be used. So if you have severe buildup in your teeth of plaque and tartar, the yellowish structure is called the plaque, and the blackish color deposits are called the tartars. So if you have this kind of deposits in your teeth, you can visit your dentist, and you can get it removed by a very simple procedure called scaling. So in the procedure of scaling, the plaque and the deposits which are present in your teeth can easily be removed. But the catch is that you have to follow up. So there might be some people in this watching this video, they might be having diabetes along with a really loose tooth, and they might be having very bad gum health, and they might be having severe loose tooth and caries in their mouth, and they might be really worried that what are the treatment options available for them. Can they do scaling on a third grade moving teeth or not? So if your condition is really very not good, you can visit a dentist. Science has progressed and there are so many treatment options available. If even if your bone is resolved and your bone health is in a very bad condition, there are so many treatment options available which can help regrow your bone. So tissues of bone are again planted into the periodontium, and that really helps with regrowth of your supporting a bone tissue. So people who are having a bad gum health and bad periodontal health, they do not need to worry. There are so many treatment options available. You just need to get assessed by a dentist. So stop worrying about your tooth health, about your bone health, and the structures supporting your teeth. You don't need to worry. Even if you have diabetes or any other disease, there are so many alternatives present these days. So if we want me to talk about the alternative methods which are available these days, we can do a part 2 of this video. And if we want me to answer more questions related to diabetes and oral health, you can write down your questions in the comment sections and I will try to answer all your questions. So thank you so much for being with me till the end of video, and we will try to make more videos in future and come up with some interesting topics. So thank you so much, and please like, share and subscribe to my video, and please don't forget to share. Thank you so much. Thank you.